It's something that many men experience but won't talk about.
It diminished over time, then it just stopped.
There's nothing wrong with me, so I don't have to see a doctor.
I thought I could live with it and then forget about it.
Forget about sex? Not likely. But many men would rather live with erectile dysfunction than ask for help.
Intimacy is supposed to just happen. It's not supposed to be something that people talk about, so it's not really easy to discuss.
Good morning.
Good morning. The ads took a lighthearted approach and gave men hope where they often felt shame. That ad aired 8 years ago. Yet many men still don't know where to turn for help. Clinics like Ontario Men's Health, a state-of-the-art facility, help men get back in the game.
That was more difficult enough just getting through the door, so we want to make it as easy as we can.
The process is similar to a regular examination. Honesty and openness is key.
We want to know everything about this. We want you to relax, be open, and we're going to be open with you, and we're all going to work together to get to the bottom of this issue.
But even once they ask for help, many patients don't follow through.
They get examined, they get a treatment, they chicken out at the pharmacy counter, and we can work with them to get them options where they can get their medication more privately as well, if that's a big concern for them.
Dr. John Aquino joins us now in studio from Ontario Men's Health. Good to talk to you.
Thanks.
How common is ED?
Oh, exceedingly common. Even by age 40, about 40% of men will experience some degree of ED, and by age 70, that's upwards of 70%. So it's a big health issue.
What are the main causes? Is it age? Is that one of them?
Well, it's not necessarily an inevitable. It's more common with age, but it's not an inevitable consequence of aging. The same medical problems that become more prevalent as men age are the typical medical causes of ED. High blood pressure, high cholesterol, diabetes, vascular disease, these all have a big impact on erectile function. Mm-hmm. And then there's anxiety.
Stress.
Yeah, whenever any ED occurs for any reason, then
it must perpetuate itself, because then you get stressed or anxious about having it.
Yeah. Whenever an intimate moment arises, instead of just relaxing and enjoying it, a guy's thinking about last time and thinking, oh, are things going to work? Yeah. And that takes him out of his zone, and the problem perpetuates itself for sure.
So you've brought in some of the treatments that we see advertised all the time.
We've all seen these on TV.
Cialis, Levitra, is that how you
Levitra?
Levitra. Yeah. So is this the only prescription available?
Well, these are first-line therapy.
Very
these pills, they're quite effective. Yeah, for sure. These are first-line therapy. They certainly revolutionized the treatment of ED as well as our discussion about it. Mm-hmm. But there are other options as well.
What would they be?
Well, if these prove not effective enough, or there's side effects or concerns about medication interactions, then there are treatments such as penile injections. It's a very effective therapy. Not nearly as scary as it sounds.
It sounds scary.
Yeah, it sure does. Yeah, but it's really not. It should be quite painless, and it's very effective.
What's involved with it?
A small, they're a very fine needle, a small amount of medication a man can inject into one of the sponges on one side of the penis or the other. Mm-hmm. It creates a very predictable response, even if there's a lot of anxiety involved.
How often is that treatment applied?
On demand. When you want it, you use it. If stress is a big issue, we can have them administer it with a automatic injection device, which makes things a lot easier for a lot of guys. So that's a very effective therapy. A lot of guys are amazed how effective and how painless it is. There's also, vacuum erection devices. These, well, the name is fairly self-explanatory. By producing a vacuum effect, a man can produce an erection on demand. This is placed over the penis, and he just applies some through the pumping mechanism after he makes a seal against the body, draws blood in, and can create a response that way.
But there must be a certain amount of anxiety too. I mean, when you have to use either one of these devices, sure. It kind of takes you out of the moment, doesn't it? I mean, it takes you out of the zone.
It can, but people are adaptable. People adapt these things into their lifestyle, into their intimacy. So life changes.
You had mentioned that there might be side effects with these. I mean, obviously, other drug interactions. You talk to your doctor about that. Yeah. That makes sense. But what sort of side effects would be causes for concern for some people with these drugs?
Well, the typical side effects of these medications aren't really dangerous. Typically, they're more of a nuisance. So it's just a matter of what you can handle. They may cause headache. Some may cause back pain, heartburn. So it doesn't mean you necessarily can't take them. You just have to decide whether it's it's for you or not.
For people who are watching, at home, maybe they themselves or they have a sexual partner who's suffering from ED. How do you get things going? I mean, if you have a partner, let's say, I mean, how do you start that conversation?
Well, that depends on the couple. You're right. The dynamics change a lot in a relationship. So I think just communication. A lot of guys get themselves in a rut by not talking about it, and they act more avoidant, and then that creates a real communication problem in the relationship. Their partner interprets that differently, maybe like rejection. So it's really important to keep the communication going early in a relationship. This is just a medical issue. Guys shouldn't let it affect their ego so much,
Do you suggest that person go to a doctor, perhaps? Or?
Yeah, for sure, a doctor. Some couples, if the problem is going...
It's such a sensitive subject
for sure.
to broach.
That's why sometimes a couple, after it goes on too long and they haven't communicated well, sex therapist is a great idea as well, because the couple needs a little help getting that communication going again and getting their relationship dynamics back on track.
Okay. Dr. Aquino, thank you very much.
Yeah.
Good to talk to you.
Too.